Hi, I'm Dr. Arvind Poswal from Dr. A's Clinic, New Delhi, India. Now, hair transplant per se is an art. One has to remember this. At our clinic, we focus on providing the cutting edge techniques as well as the most natural looking hair restorations. That is very important because when you are going to get something on top of your head, you are not going for anything which looks, which anyone can recognize as a hair transplant. So, first and foremost, it should look absolutely natural, and that is what we specialize in. Also, because we invented body hair to scalp transplant and beard hair to scalp transplant, we offer our patients a lot more fuller, a complete hair restoration. In my experience over more than 2 decades, I know anyone who has lost hair or anyone who is bald does not want to go from being completely bald to being only half bald. And if we look at the donor area, the safe donor area of the scalp, then it is never going to be sufficient if a person is extensively bald from, let's say, here to this area. So that is where beard and body hair transplants to scalp comes in. I remember for many years in early parts of 2000s, people used to come to me, patients asking, saying that I have hair all over my body. God has given me hair all over my body, but the only place He hasn't given is where it matters the most, that is the scalp. So we solved that problem in between 2003 to 2006 by introducing body hair to scalp transplants. After that, there has been a steady demand from around the world for such procedures, and I hope you benefit from them too. The second reason I would say why you should choose here Dr. A's clinic is because one, I personally prefer to treat my patients as if they are my responsibility for the rest of my life. It's not that you come here, I treat, and then you are no more in contact with me. Hair transplant, I normally tell to my patient, is more long lasting than a marriage. You can get married and then you can get a divorce. But once I have transplanted a hairline for you, that is going to stay for the rest of your life. So that brings me to the second point. Again, you can call it why Dr. A's clinic, and I'll explain to you. Now, there was a myth for a long many years that hair transplant should not be done for anyone below 35 years of age. And my belief was that most of the important decisions in life are taken much before that. Your marriage, your friendship, your job, everything. So if a patient person is young and he has lost just a bit of hair in this area and this area, and we tell him that no, we are not going to do your hair transplant, I think that's not fair. What I prefer in my clinic is we prefer to educate patients so that they know, okay, they should know, like if you have a family history of hair loss or baldness, it may be that your maternal grandfather may have it or maternal uncle, because genes come from both sides. So you may have experienced hair fall. And if you have sufficient donor, that is, if you have a lot of donor in the beard, on the head, and maybe even on the body, then it is just a matter of planning when and how much hair to transplant to create the look that you want to do. So that is very important. That age is not the deciding factor, it is the patient's awareness that should be the deciding factor. Coupled, of course, with availability of sufficient donor hair. Now, the other thing which I find many places hair transplant or restoration is commercialized. I'm against this. It has to be a one person to person relationship between the patient and the doctor. I know I cannot do hair transplant for everyone, not even for a fraction of bald people in India, not to mention the world. So, whomsoever I do, it's my responsibility that I guide him correctly. So, the first thing which we ask our patients is their family history. Now they are surprised sometimes and they say, no, my father had hair loss at a much later age. So I try to help them understand that even if he had hair loss at a later age, remember 20 years from now, even if you are bald in just this much area at present, 20 years from now, you may lose a lot more hair. So what then? So anytime you are going for a hair transplant, remember it is a big commitment. You have to stick to it. So once we know, let's say, for example, a person tells that his father is bald, like totally bald, like the father of our nation. So then I have to search for the donor. Does he have lots of beard? Does he have lots of body hair? If yes, then I can ask him, okay, tell me which hairline you want. He may go for a young hairline. He may not settle for a very mature hairline. If he has sufficient donor, then I will give him a hairline which he desires the most. Now, here we come to the third aspect in hair restoration. Now, I always ask my patients, and here at a Dr. A's clinic, we always tell, see, this is not life and death surgery. I will help you in making the correct decision. But I want your input also. What is the hairline you really want to live with for the rest of your life? I don't want you going away and saying, okay, this is the hairline which Dr. Arvind Poswal gave me or which Dr. A's clinic gave me. You give me a hairline, tell me about a hairline, show me a picture. It can be of an actor also, doesn't matter. So that I give you that hairline. When you get up in the morning, you wash your face, you look at your hairline, and you should fall in love with your hairline. एक आदमी को अपनी हेयरलाइन से मोहब्बत होनी चाहिए, ये मेरा मानना है. तो वो उसके लिए बहुत नेचुरल लुक ज़रूरी है. Therefore it has to be one completely natural looking, and second, as per your desires. If you do not have sufficient donor, there are people who don't have much beard, not much body hair, then I'll tell you at the outset that okay, this is the donor which you have, and this is how we can use. So if you ask me why come to Dr. A's clinic, I can tell you that yes, we are above board. We'll educate you about all aspects of hair transplant. We'll tell you what is correct method, you can go for it. Apart from that, I'll not sell hair transplant to you. That's not the way an artist or a doctor should work. So that is why I prefer to keep myself in a position where I can offer the best quality to you. We don't have too many branches or franchises for this purpose alone.